You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering a breast reduction or breast lift. With us, we have board-certified plastic surgeon, Dr. Grant Stevens. Dr. Stevens, welcome to the program.
Thank you, Randy. Thank you for having me.
Big topic. You say
Huge.
The happiest group of patients are your breast reduction patients.
Yes. Breast reduction patients are a unique group of women who are so happy. They're over the moon happy.
Yeah, and you even said, don't get me started on this topic, right? I could go on forever on this topic.
Yeah, they're unbelievable. They're the happiest patients. You know, they feel better, they look better, they can wear clothing they could never wear, and they can do activities they couldn't do. Think about it. Where else do I get to go to work and make people feel better, look better, give them better clothing options and better physical activities, things they couldn't do?
Now, they did a cartoon about you, making fun of you because you're making women's breasts smaller.
Yeah, yeah. And people think a plastic surgeon is supposed to make breasts bigger, you know, that we do breast enlargement. And of course, we do some. But I do as many breast reductions as I do breast augmentations. You know,
So is it always lifting involved when you're doing
Yes,
that?
whenever we do a reduction, we also do a lift, and I hope we get to talk a little bit about the laser bra and laser breast reduction. But I'd like to spend some time first about breast reductions. You know, women who have large pendulous breasts are very uncomfortable. They're miserable. They can't wear clothing that they want to wear. They can't go out and participate in sports that they want to do. You know, guys think, well, big breasts are something that's really fun to have. Well, let me tell you, these bra straps hurt like heck. They get bra strap indentation. They get a rash under their breasts. Big breasts are a real pain. And when we can help women, give them a more reasonable size cup size and lift them, they are so happy. They're the women who bring me the candies, bring me the cookies, they kiss me. I love them. They come from everywhere.
One of the most technically demanding areas of plastic surgery to do this right, make them look good?
You know, is it the most technically demanding? I hesitate to say it's more demanding than a great facelift, because I do as many facelifts also, and facelifts are very demanding in a different way. But I will say this, a lot of people approach breast reduction as just hack it off, put the nipples up there, and that's a successful breast reduction.
Is that true? Is that?
A lot of them. Go online, look at the various websites. I am floored at the level, the mediocre level of breast reductions that people accept. And you know, because women are happy with the pain relief, they tolerate it. I'm convinced of it. I've been on a mission for over 20 years to make breast reduction patients look as beautiful as breast enlargement patients, and I know we've done that. If you go on to the laserbra.com or any of my laser or non-laser breast reduction sites, you'll see examples of hundreds, if not thousands of women who've had breast reduction surgery, and I would tell you that their breasts look as beautiful as breast augmentation patients.
Okay, now I've got a bunch of questions about this
Fire
laser
away.
bra, things like that. But I want to talk a little bit about your credentials. I mean, you publish papers in the journals about these surgeries.
About breast reduction.
You teach plastic surgeons all over the world, is that right?
Yes, I do.
And
I'm what's called the traveling professor for my society.
so there's a lot of people out there with this issue.
Oh my word, the number of women with large breasts are causing them pain and causing them to change their lifestyle, to alter their lifestyle because of these large breasts. And they benefit so greatly from this surgery, Randy.
Why do they put it off?
Some of them think that their nipples have to be removed. Some of them think that they can't afford it. Some of them are just scared of the procedures. Some have seen the horrific scars historically. It's mainly a lack of awareness, I think. That's the main problem. But now, thanks to the internet and to programs like yours, women are availing themselves to this all over the country.
You talk about this on television. I mean,
do.
you've been all over the news. I mean, you're on just about every show. I mean, you've been on Dr. Phil, you've been on The Doctors, you've been on Dr. Oz.
Well, we've been on a number of them. I've been very fortunate. There's
Now
no
you're
doubt
on this
about
show.
It. Yeah, hey,
So
I
now you
finally
made it. You made it.
Finally made it.
You were thinking the same thing. So, you know, one of the things that we wanted on the show for quite some time.
Thank you.
The public, maybe they don't know that there's huge differences in techniques and approach and philosophical differences. So let's...
Especially when it comes to breast reduction surgery. The variation between the good, bad, and the ugly is gigantic. In this case, more so than any procedure in plastic surgery. For instance, when we do this procedure, it's 2 hours or less. It's maybe a thimble full of blood loss. There's no hospitalization. The recovery that night, you're up and about. There are no stitches that come out. Everything is dissolvable. There's no drains. I see the patient.
No drains?
No drains at all. I see the patient.
Isn't that a requirement, the drains?
Nope, you don't need drains. If you do meticulous surgery, there's little or no blood loss. There's little or no oozing postoperatively. We do as an outpatient. I've done numerous research studies to show this and have published it. So this is not me just out there screaming it out in the wind. This is after peer review articles have been published. We've proven this is safe, it's effective. Women can have a breast reduction in 2 hours or less, go home, sleep on their own pillow. Come in and see me the next morning. I put them in a normal bra or a surgical bra. I see them a few days later, and you know what? If they live out of town, they're out of here in a week or less. We've had women from 63 countries, Randy, come in for this laser-assisted breast reduction, and all 50 United States. I'm talking thousands and thousands of happy women.
How is it normally done? And for people just tuning in, we're talking about breast lifting, also using lasers and no drains from Dr. Grant Stevens. How is it normally done, and how do you do it?
Well, there's no one way that it's normally done, but historically people have taken the nipple off, or they've hospitalized the patient, or transfused the patient, or used drains, or staples, or stitches, all things that result in excessive scarring, excessive recovery, excessive bruising, and frankly, the aesthetics are really not that great. They don't look like beautiful breasts should look. But what we've done is perfected that, made it easy for the patient. By using the CO2 laser, we minimize the blood loss. We also maximize the blood supply to the nipple. I've never removed a nipple for a nipple graft, never. So we preserve blood supply.
Is that being done a lot? I mean, is that a common thing every day?
Well, most people now are doing similar things, but there are still some people that say if it's too big, you have to take the nipple off. And I say that's not true. We haven't had to do that. This way, younger people can have it done. We've done 16-year-olds. We've done plenty of college-age kids who have this genetic predisposition, these enormous giant breasts, which ruin their life. And by
Does it really?
You know, Randy, it absolutely does alter their lives. It's unbelievable. I can give story after story. The 16-year-old who was a swimmer at Los Al High School, and then between her junior and senior year grew so big she couldn't compete because a Speedo wasn't big enough. And we took care of that. We had a pastor's daughter who was 14 or 15 years old, and her breasts sat on her thighs. They were so big. You've never seen breasts this big. Her poor little back and shoulders were getting killed. There are other women in their 20s and 30s, they get gawked at, they feel socially uncomfortable, or physically, they start breaking down. It's just not normal to have big breasts like that on little tiny bones. I had one grandmother, mother, and daughter over a Christmas holiday, and guess who recovered the fastest?
Who?
The grandmother.
Is that right? They all three did it?
She was so funny. She started laughing, and she started giggling. And I said, "What are you doing?" She said, "I haven't been able to see my shoes and tie my shoes my whole life." She wasn't looking over her big breasts. And
So they all did it together?
Yeah,
It's
over
like
a 2-week
runs in the
period.
family of genetically?
Yep.
Well, that's nice.
Yeah, it's unbelievable. And it's story after story. It's life-changing surgery, these breast reductions.
Is it one of the most rewarding for you?
No question about it. I mean, I love taking care of kids and doing breast reconstruction after cancer. Those are big, rewarding procedures. But taking care of women who can't get rid of their breasts any other way, Randy, you can't diet and exercise big breasts away. It's not going to work. So if the genetic load, your genetics are such you're going to have these enormous breasts, and it's hurting you physically or other ways, then breast reduction may be something you should consider. And now we've made it so affordable and so easy. Women can spend a couple hours with me, a week recovery, and their lives are changed forever.
So laser bra, what is that?
Okay.
Is that something
Laser
you
bra.
coined,
Yeah,
laser bra?
I did. Years ago, we were always discarding and throwing away the extra skin. We were taught, cut the skin, throw it away, right? But I thought, well, I'm going to start lasering it with a CO2 laser and see if I can fashion an internal bra. Looks like a shelf bra, looks like a hammock. And so I played around with it a little bit, and this is back in the 90s. And then I started looking, I was doing it with reductions at first, and then I would hitch it up or actually tack it up on the inside of the chest wall, and sometimes laterally. And I noticed that these breast reductions were doing very well, and they stayed perkier. So I thought, I wonder if I can do this with the straight breast lifts, with an implant or without an implant. So I started doing more of it, and more of it, and more of it. Next thing I knew, I coined the term the laser bra. Now, the interesting thing about it, a lot of people gave me grief about it. And they said, why are you doing
People
this?
meaning other plastic surgeons?
And it's come full circle. A lot of people said, why are you doing that? Or they had the misimpression that somehow it was skin that was off the body, that it wasn't vascular, it wasn't alive. And I said, no, that's the skin we always threw away. I just keep it attached. Take the outer skin out so it looks like a chamois, and I tack it up internally to lift the breast. And I noticed the breast stayed perkier, and the breast, frankly, looked better to me.
So you're using their own skin inside
Right.
to
tack it up. Now let's fast forward to what's going on today. Right here today, we've got a whole industry now called ADM, or acellular dermal matrices, with Alloderm and Stratus and various other substances that surgeons are using to tack the breast up. It's cadaver skin or pig skin, which has been treated, that people buy, and then they put it in the breast to tack up the breast. They're doing the very same thing with skin from a pig or skin from a dead person.
Could they argue the results may be better that way?
I guess you could make any argument if you want, but I say, why not use your own skin? It's yours, you own it, I don't have to buy it, and there's no question about whether or not you can tolerate it. You're tolerating yourself pretty well. So I think it's kind
So
of
it's a
funny.
better way the way you're doing it.
Well,
I mean, with their own skin.
It's certainly at least as good, and certainly a lot less expensive. And I think it's kind of funny that it's gone full circle. From first I was crazy to do it, to now they're doing it, but they're doing it with something out of a package instead of something in their own body.
A lot of people thought you were crazy about a lot of things, right? Because you did a lot of firsts. I mean, you even coined the term mommy makeover, right?
Yeah,
They didn't
things.
want you to be doing a bunch of procedures all at the same day, and you were doing that for
Years ago.
So this is one of those things.
Well-
so the laser bra,
Yes.
is it being
Yeah.
called that now all over the?
Well, a lot of my pupils, a lot of my residents and so forth call it that, you know. I'm sure my detractors don't call it that very often, but they can go to laserbra.com and check out the undeniable results. You tell me if they look better. If you don't think they look
let me
better,
see one of your photos. I know we can't really show these, but show me so a laser bra. So for people just tuning in, and I'm going to paraphrase you a little bit here, but that breast reduction, that a lot of women, their belief is that you can do the breast reduction, you're going to feel a lot better, carrying around a lot less weight, but one of the things you got to give up is a beautiful breast. You say that your breast reductions, you end up with both.
absolutely.
A beautiful breast and a lift.
I would say
and
a
a-
more beautiful breast and a lift, and your life improves. You can wear the clothing you wanted to wear, those hot bras, those hot tops you wanted to wear. You can dance, you can run, you can participate in physical activities. Your viewers know who they are. They know who I'm talking to.
So this
These-
is a big group of people.
It's a giant group of people. I will tell you something that I have permission to tell you. I did my mother's breast reduction. I grew up with a woman with large breasts. I watched what it did to her. She'd come home, lay down, rest her back, take her bra off. Her back hurt, her neck hurt, her shoulders hurt, bra strap indentation. She was miserable. I'm happy to tell you, when I was in private practice, I kept sending her other docs. She only trusted me. I'd already done her facelift, and she said, honey, I really want you to do my breast reduction. And I had a little trepidation about it, and I will tell you, Maria, my nurse, took care of her post-operatively, but I did her breast reduction, and it changed her life.
In this laser
Yeah,
bra.
a laser-assisted breast reduction with a laser bra. That's correct.
So very few guys are doing this across the country.
Well,
Like
more
less
and
than-
more are, but
like more,
it's not
75% are not?
Oh, larger than that. There's not even 5% that are. And I want you to know something. I'm not critical of traditional approaches on this, okay? Breast reduction surgery is terrific. And I don't want your viewers to think
Okay.
if they're not doing the laser, they're getting some bad surgery. I would just suggest to you that 2 hours or less of surgery, no real recovery time past a week. You don't need hospitalization.
How long does it normally take, and what is the recovery normally?
Well, I see cases of 4 hours long. I see hospitalizations and transfusions and weeks recovery and drains and stitches and all kinds of nonsense.
Does this bug you, by the way?
Bugs the heck out of me.
This is your thing that bothers
Absolutely. It's one of my big deals because, as I told you, these are the happiest patients in my practice, Randy. These women look great. They feel great. They get to do things they couldn't do and get to wear clothes, sexy clothes and nice clothes they always wanted to wear.
you. So plastic surgeons will watch this show. What do you want them to know about this way of doing it?
I want them to at least give it a second look, to consider it, keep doing a great job with their breast reductions. They don't need to use drains. They don't need to hospitalize the patients, and so forth. There's a lot of different ways to get a great result.
And is it substantially more to get it done the way we're talking about?
No, it doesn't cost a penny more.
So it doesn't cost more to get it
No.
done this new modern way
Doesn't
with
cost-
better looking. I mean, because that's a key. I guess any woman wants to have attractive breasts, right?
I would think so. But remember, it's not just about that. The first thing that brings them in, for the most part, is their back
Right, the
hurts,
pain,
their
the
neck
pain.
hurts, the pain.
But they want both. So
Right. And so why should they be asked to give up a beautiful breast just for pain relief? They can have it all. And that's the thing. Up until now, they've been told, well, okay, you've got big breasts. Sorry, we can get rid of them, but they're going to look terrible. Or they're going to look like pancakes. Or they're going to have Frankenstein marks. Or marks where the drain was. I see these women that come in and see me. They've had breast reductions elsewhere. And frankly, the breasts don't even look like breasts.
so in your head, you're shaking your head.
Yeah, and I know how to fix them, and I do it all the time. That's called secondary breast reduction or breast lifting. And I'll take a bad breast reduction and fix it. So just because they've had a bad one doesn't mean I can't fix it. So,
Okay. And that's what I like about you two. We were talking on the telephone, and you said, I don't want to come on your show and say anything negative about anybody.
I don't. Everybody's trying their very best, and I'm not here to throw stones or pick on people.
But you lecture, I mean, you lecture on this topic to plastic surgeons across the country. all
Across the
time.
world.
And you love this procedure.
I do. One of my favorite
Do you
procedures.
think someday this may be the gold standard?
I don't know. I like to think we'll even push the ball a little bit further, something else along the way.
No, we can't show this to the audience. Let me take a look here. So,
Okay.
so this is a woman that normally would have like a ton of scarring.
Right. She has a triple D breast. You can see that. And
Mm-hmm.
I've reduced her to a C. I did her tummy tuck at the same time. She wanted to have a thinner figure, and she had these enormous pendulous breasts that are weighting her down. Her small frame is being negatively impacted.
Now, without exaggeration, I can't see any incisions here.
Yep.
I mean, there's none on this one.
Right.
That
Okay.
cannot be typical.
Okay, so we talk about that. I kid the patients. I say, pick your parents well. Genetics matter. In certain ethnic groups, heal poorer
Where'd you
than others.
hide her incisions?
Well, that's the artistry of it, Randy. We try to make
that
the
secret?
incision. No, it's
Oh,
not
okay,
secret. We
okay.
teach it every day in
All
the
right.
marina.
Okay.
We make the incisions as short as possible. We hide them in natural creases and folds. But at the end of the day, your genetics do play a role. But what I do plays a role too. I'm very respectful of the skin. I don't put any stitches on the outside. I don't staple things. Randy, I see people stapling in these incisions closed. My own colleagues.
Is that happening all the time?
Not all the time, but
When
when
it
it does happen, I cringe. Most don't do that. But putting the incisions, or excuse me, the stitches under the skin helps because you don't see the stitch marks. We all grew up. You know what I'm talking about when you go to the ER and you get the stitches. Well, we don't do that. And we don't put that ugly drain sticking out of their chest that they've got to take care of for a week. That's silly. We don't need
And I
it.
guess the sad part is that people don't know the difference. And that's one of the nice things, you coming on the program, right, is to let people know their options.
Yeah, that's what I'm here for.
And so just like when a woman goes in for a breast augmentation, they get to choose size. Do they also get to choose how small they can go?
Yes, within
And
reason.
how is that done?
Well, most of my patients want to be a C cup. I'll just tell you, about 85% asked to be made a C, and about 10% a B, and about 5% a D. We can only make them so small. We can't go smaller than a B because we need to preserve the blood supply to the nipple. But we look at pictures together. You know, clothes off the rack are generally a large B to a small C, sometimes up to a medium C. And a lot of women want to do that because let me tell you, if you've been sporting triple Ds your whole life, you're not buying clothes off the rack and you're buying separates. It may not mean anything to you, but to your viewers out there with large breasts, they know what separates are. And they're breaking sizes. They're buying medium bottoms and extra large tops, or having their seamstress make the tops that fit them. Or they're wearing reducers and minimizers, things you probably don't even know about.
No, never heard of this.
But these women, they know all about it. And I can deliver them from that.
And how soon do they, I mean, when they come back in, do they like to tell you their stories of,
Oh,
oh my
my
goodness, I should have done this years ago?
Yep, that's the number. First
They
thing
say
I
that?
hear, thank you. Second thing I hear, I didn't believe you, but you're right. It didn't hurt. Third thing, why'd I wait so long? I get it. 1, 2, 3. Thank you. You're right. It didn't hurt. Why'd I wait so long? It's like clockwork.
You're on fire about this topic. I mean, you love
I'm pretty
this topic.
passionate about it. I told you, these women are my favorites. They come in, I get hugs and kisses from them. I mean, what kind of guy wouldn't want to get hugged and kissed by
Let me
these
take a look at
wonderful
that other one,
ladies?
because I want to look at incisions just for a second.
Yeah,
We
try
can't
to
show
find
these on
out. I can
TV.
show you some more.
This is another one where just a little incision underneath.
Mm-hmm.
And I wish we could show these. But these are on your website.
They are.
Oh, that's the good news. Okay, so
Los Angeles Breast Reduction or thelaserbra.com.
thelaserbra.com, they could see these, and you will
Or
see.
Los Angeles Breast Reduction or marinaplasticsurgery.com.
Okay. Now, what about on the consult, so we know what that's like?
Mm-hmm.
What do they want to know? Like, what are the frequently asked questions? Maybe you could answer them right here.
Sure. Does it hurt? How long will it take to recover? Are you removing my nipple? How big are the scars? Will I see the scars? I tell everybody it's a trade-off. There's a certain amount of downtime. There are incisions and there will be some small scars. And some are more visible than others. But no one has ever said to me, I wish I didn't have my breast reduction because of the scars. Think about it, Randy. I've done thousands. If scars were a big deal, somebody would have said to me, darn, I wish I hadn't had that breast reduction. I hate these scars, and I've never had that said to me in 30 years, not once. So, this is a very great operation for these women. The other things they ask me about is, when can I get back to work?
Yeah.
It's generally about a week, unless you're really physical and heavy job. I've done 2 longshoremen, and they called themselves longshoremen right here in San Pedro, and they took 2 weeks off. I did an anesthesiologist from Sacramento, and I did her on a Thursday. I was supposed to see her on Monday. I saw her on Friday, I was supposed to see her on Monday. She called me on Monday. She was in Sacramento doing anesthesia, and she said, I'm in here doing a breast reduction at the hospital in Sacramento. I'm sorry, but I left on Sunday. So I've had them leave in less than a week. I want to kill them when they do, but I prefer that the out-of-towners stay a week.
Is there an age range? I mean, how
You know, in this procedure, I mentioned the youngest I've ever done is 14 or 15. It was that pastor's daughter with breasts that were huge. The pediatrician sent her to me. Mm-hmm. I did an 88-year-old. That grandmother I told you about, she was 88.
Very nice.
I've done many in their 70s. I mentioned my mom. And people are living longer and they're healthy, as long as they're healthy.
Because 75 is young today. You're saying
That's
in
right.
their 80s.
Exactly.
And but there is a big population of women in their 70s that can use this.
And they're breaking down. They've been holding these pendulous heavy objects on their chest wall for years, and their shoulders are breaking down. And they're so fun. They talk about how they have a weight off. I have a woman who walks in and it looks like someone pulling her from the top of the head, and she giggles. I told you about the grandmother that giggled. She got to see her shoes for the first time.
For clarification, the laser you're using is just for reduction surgery?
No, that's not correct.
Okay.
This CO2 laser I'm using can be done with reductions. I do it with all the reductions, but it also can be done with lifts. So we do breast lifts either with or without implants. So this laser bra I was telling you about, what's beautiful about it is I can create an internal bra, like a shelf bra on a woman's blouse, that can be used to lift the breasts that are just saggy. Some women have saggy breasts that aren't too big. They've had their babies, they breastfed and so forth, and they just want to lift. And I use the laser bra for them.
Now, for people just tuning in
Yeah.
about this laser bra, because you talked about this quite a bit.
Sure.
So on the regular lift, tell me what you're doing with the laser bra? For people
Instead
just
of
tuning
throwing
in?
away that extra skin, we're treating it with the laser and making an internal bra with the woman's own tissue that we'd otherwise throw away. So we're creating an internal bra with the laser. It's like a shelf bra or a hammock that lifts the breast up, and then we bring the skin around and we lift the breast. Now, we can also do this with a breast implant. For instance,
Okay.
here's a woman whose breasts, she's had babies, her breasts used to be fine, she breastfed, they're smaller than she likes, and they're saggier than she likes. Now look at them after I've done the laser bra and a gummy bear breast implant.
Yeah.
Now they're more youthful, they're fuller, it restored her pre-baby breasts.
Now, we can't show these on television.
you could.
But they could go to your website. This woman's nipples are pointing to the ground.
Before.
And now she has very perky breasts. And the incisions.
Can you see the incisions?
You could just, 'cause
Barely,
I'm
right?
trying to look at them, but yeah, you can't see them.
Right. And so if you go to the laserbra.com or gummybearbreastimplants.com, you can see this woman. You can see her right there. A lot of these women even talk to my patients. It's unbelievable. They're very happy with the laser bra.
And I think we should mention, when I look through your bio, I mean, you have probably performed more of these procedures than any other surgeon.
Well,
true?
we presented some large series of breast lifts from all over the world, and I think we have the largest series that have ever been published.
Okay, so you publish about it. You've even written in medical text or about this?
Yes, we've written the chapter in Graven Smith and a number of textbooks.
Why is this, by the way, your thing?
You
Like
know,
your
I don't
passion. You
know.
said I'm on a crusade, I think you said, or something like that earlier?
Well, probably growing up with a mother with large breasts and seeing how much it hurt her and how it impacted her life, it had to have affected me. Also seeing the terrible results I saw in residency and watching people dance with glee around a case that I thought looked terrible. I'm an artist and I look at these breasts that look terrible and I thought, why are they so impressed with themselves doing these breast reductions that look like pancakes? And I wanted to make a conical, beautiful breast. I set out to do that almost 30 years ago.
When you say like pancakes, okay, so you're seeing lifts or reductions, but the breasts are completely flat.
Yeah, they look like a stack of pancakes.
So
They
you
don't
could
look like a beautiful breast.
So
You know, we all know what a beautiful breast looks like, right? I mean, it's not like some mystery.
So you could still do a reduction or a lift and give them a perkiness
Better
or a high
perkiness.
projection.
Better looking. It's not about not going backwards, it's about going forwards. It's about taking a large, pendulous, heavy breast and making it a youthful, perky, beautiful, gorgeous Venus de Milo breast, which, oh, by the way, takes all the symptoms away, too.
Do plastic surgeons, when they have tough breast cases, ever send you patients?
I have so many cases sent to me by other plastic surgeons. Last week, I got one sent by a dear colleague in San Diego. I had another one from Las Vegas, two come right to mind recently. Some of these are very complex revisions. And frankly, I do them every day, and so it's pretty easy. I mean, it's never easy, but it's a lot easier in that I do it all the time. And some of my colleagues just send me cases. It's the biggest compliment I can get. I think of another one from a colleague in Chicago who sent me a veterinarian's wife recently. It's a huge compliment, and I take it with a big responsibility. I'm flattered.
Dr. Stevens, we're out of time. Final
darn.
message, somebody, they want one of the procedures or considering it, or they're afraid of incisions or scarring or downtime. What do you say to them? Final message.
Give me a call, come in for a complimentary consultation, go to my website, thelaserbra.com, Los Angeles Breast Reduction. Come on and see me and let me talk to you.
Good. Thank you for coming to the show. Great
Thank
stuff.
you for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.